Welcome to Ponchatoula Live, the show where we make it easy for you to connect with the people of Ponchatoula. I'm your host, Parker Layrisson, and this week I'm incredibly excited to introduce you to a guest that I greatly admire, and you might not know because unlike me or the last few guests we've had, he didn't grow up in Ponchatoula. He chose to move here all the way across the country because it's a special place. He lives here in the Hammond area, and he's one of the preeminent doctors in all of Louisiana. He's really nationally acclaimed. This is Dr. Steve Lee with the Advanced Pain Institute in Hammond. So today we're going to talk about Dr. Lee's life and how he made it all the way from New York to Louisiana, about his education and training along the way. We'll learn about what it's like to train at Harvard Medical School. We're going to learn about, of course, what he does. He's a double board certified medical doctor, and he's great at what he does. And I learned that because he treated my own mom, and he's done great things for her, and she sings his praises all the time. And we'll also learn about his own personal battle with COVID. He was one of the first physicians that I was aware of in our area to contract COVID. And he can tell us how serious that is. But he can also talk about what they're doing in the medical field to treat people with COVID and keep the rest of us that have not contracted COVID safe. So with no further ado, I will bring to you Dr. Steve Lee. Dr. Lee, I will add you to the screen. Welcome to the show. How are you?
I'm doing great. I'm glad to be here.
Well, thank you so much for coming on. As I mentioned in the introduction, I've been a big fan of yours. I practice personal injury law, which means that 100% of my clients were hurt, they're in pain, and that leads to me dealing with a lot of doctors. And doing that for nearly 20 years here in the Ponchatoula Hammond area, I've noticed a great transition in our local medical field. When I arrived back from school and government service to open up my own practice in 2004, we didn't have a lot of specialists around here, or nothing compared to what we have today. And we certainly didn't have Harvard-educated, Harvard-trained doctors like you as pain management specialists. So it's been great, not only for my clients and your patients, and to be able to go to a doctor of your caliber, but it's been great for my family because sadly, as you well know, 5 or 6 years ago, my mom was involved in a serious wreck and she was injured and she was in a great deal of pain, and you have helped her a ton. And of course, she's given me permission to say that we're not violating HIPAA or any attorney-client privilege issues. But Dr. Lee, all that being said, tell us about your background. And we can start wherever you want, in school, growing up, whatever. But tell us about we'd like to hear about your journey and how you got here to Ponchatoula and Hammond and started serving this area. Sure. But tell us about the early years long before that.
Sure.
What's your background like?
I'll pick up the story where I grew up. So
okay.
I was born and raised in New York in a place called Poughkeepsie. So my dad, he had come over, an immigrant from somewhere in China that I've never been to before. Wow. And back in 1965, I believe, when the Immigration Act had passed, allowing professionals to come over to America.
Was he a physician like you?
He wasn't. He was an engineer.
Okay. So, all right.
Yeah. He ended up. So the reason why I was born in Poughkeepsie, New York, was because by that time in the late 70s, he had purchased a home because he had a new job with IBM. And back then, that's the type of company where if you work there, you're set for life. So,
yeah, Big Blue. Yeah, that was the gold standard in that age for sure.
So I was born and raised in Poughkeepsie, New York, where I went to high school, and it was a great middle class upbringing, playing basketball on the weekends with my neighbors, playing video games, and all that. High school just always wanted to learn everything I could about the body, how it works. I was very enthusiastic about science and math. So I was able to graduate from high school early, and I was able to get a scholarship to go to different colleges. Being so close to New York City, growing up so close to it and visiting so often, I wanted to I was thinking about NYU. So I started there during their summer program. And then because I had ended up getting a full tuition and also room and board at Brigham Young University all the way in Utah, which is like a complete 180, I guess, in terms of
Right.
culture. But so I ended up making that huge decision to see what it would be like in Utah.
Beautiful skylines in both places, right? They're mountains or
Sure.
skyscrapers. Either way, it's you're looking up. It's not like Ponchatoula where there's one elevator in town and 3 stories is as high as it gets.
And it was a great experience. I learned a whole lot in dealing with
Mhm.
different cultures, different people from different backgrounds, and so
Right.
by then I was seriously thinking about going into medical school, and I was also running track and trying to keep a good balance in my life.
What were your events in track?
I ran the 800 meter and the also the 4x8. I also tried doing in high school. I did the hurdles, but unfortunately,
Okay.
once you get into college, the men's hurdles, they become much higher, and so
Mhm.
not quite tall enough to do the high hurdles in college.
Right. Okay.
Uh, so,
Well, I think
anyways,
my dad might be watching with my mom, and I asked because he's a track and field nut. You never know it
okay,
by looking at me, but I'm the son of a sprinter, and Dad loves that. We used to take trips over to LSU to watch track meets. And Dad, if
sure,
you're
yeah. So
watching,
I was middle
you're not the
distance.
only runner in town anymore. What's that?
And so yeah, I had a great time at
Hmm.
BYU. I
Cool.
ended up I got chemical engineering freshman of the year, but decided that was going to
Which
be
must
my
have
first.
made Dad so proud, the engineer, right? So
Absolutely, yeah,
at,
because my
at
my
that
dad,
point, did he think you were following in his footsteps, or was medicine already on the mind, and was that
he was
clear to
urging me
everybody?
to explore medicine.
Okay.
He had his degree in um, mechanical engineering, and he had a
Okay.
professional engineer designation. But I also really enjoyed philosophy and English, and so
Hmm.
if I wanted to delve into those topics, then it made more sense to change my major, because chemical engineering is such that in order to graduate, you need to have a ton of credit hours within that program, and you
Right.
don't have time to see much else, or learn
Very intense, as I understand it.
other parts of the curriculum. So, anyways, uh, decided I wanted to do medical school. Studied really
Mhm.
hard. Really kicked butt on the MCAT. Got good grades. Got into Washington University in St. Louis.
Great
Uh,
school.
so at the time, I was really into rankings, and so I picked
Mhm.
up U.S. News and World Report. I'm like, "Ooh, this is scored pretty high." Um, um, so it was expensive because medical school wasn't full tuition for me,
Gotcha.
but it was an amazing experience. All of a sudden, I'm with other students that were all fantastic test takers and
Right.
all pretty amazing academically, with all these wonderful studies and participation in all these amazing things.
Mhm.
So yeah, that was also fantastic to be in that environment. So I was in St. Louis then, and while I was in St. Louis, I also decided that I wanted to do additional research in the medical field, so that I ended up getting a master's degree as well in that. So I graduated with a dual MD
Okay.
MA degree.
Okay.
So at that time, I still didn't know that I wanted to do pain medicine up until my third year of medical school, where we started doing rotations. And so
Why
by
don't
the
you tell
third,
our viewers about how that process works? Because you're talking to a guy with a JD, not an MD, right? Classic liberal arts grad, know nothing about how the medical
sure,
education works, and I bet a lot of our viewers are in that boat. I mean, most everything I learned was from watching Grey's Anatomy with my wife on Thursday nights, right? So, what is that process like? Rotations and the progression of med school as you get into those latter years, beginning
uh-huh.
in year 3. What's that
Right.
process like?
In my experience, so it's now been a little while since I graduated, but the first 2 years of medical school are traditionally didactic um,
Mhm.
years, where they give you tons and tons of medical information for you to synthesize, so that you can be prepared to pass the medical boards. There's the
Okay.
USMLE step 1, 2, and 3 that one needs to pass in order to be able to get your degree.
So would it be
So
fair to characterize those years as more academic and less practical? You're not doing clinical type work
absolutely,
yet.
first two
It's think
years are
okay.
academic, third
Okay.
and fourth year are clinical.
Okay.
So the step 1 test is basically the final exam for the academic years.
Gotcha.
So by the time I did year 3, I was already interested in working in the operating rooms. And
Mhm.
so I was very interested in surgery and anesthesia
Okay.
and taking care of a patient in that acute setting. So I did rotations, obviously, in both those fields. And while I was in my anesthesia rotation, there is a subset of anesthesia where we take care of people with chronic and acute pain.
Okay.
And in that clinic, remember, Dr. Swarm was the head of that section at the time, and I was floored when we were taking care of a patient with this chronic facial pain that was literally affecting his whole life. That he couldn't do anything. He was completely disabled. And so I'm following Dr. Swarm, and I see him use this needle about almost a foot long.
Yeah.
Sticks it right into
You
the
face
patient's
pain, right?
face.
So you're talking needle a foot long and face pain. You got my attention, doc.
So it was about a foot long, and he
Uh-huh.
threads this needle using X-ray guidance exactly to the set of nerves that were irritated and
Wow.
bothering this patient. And successfully, after this injection was done, this patient had no pain in his face. And I was like,
It's incredible.
wow, how
Yeah.
amazing would it be to be able to do that in the future? So that was when I first thought, you know what, this sounds like something that I'd like to do for the rest of my life.
So you see this incredible procedure, just amazing results. Somebody goes from tremendous pain to, relief,
Sure.
and that motivates you to make that your life's work and your passion. Now, as I understand it, as we sit here today, you're double board certified in anesthesia and in pain management. Is that
Yeah,
is that
so let
correct?
me explain that,
How's
because
that process
a
work?
lot of people don't realize that there are certain primary specialties in the field of medicine.
Okay.
Pain management is not a primary specialty.
Gotcha.
So you can become a pain management specialist going through different avenues. The most common, most quote accepted traditionally route is through anesthesiology. So
And
uh,
that's what you did, right?
so that's what I chose to do. Other
Okay.
routes have been set in place, such as through physiatry.
Mhm.
There are some neurologists that also go into
Right.
pain medicine, but
Okay.
mostly it's through anesthesiology. So I decided to go through anesthesia, and I decided to go into residency. So during that process, it is even more nerve-wracking than, hey, which will medical school accept me? It's,
Right.
well, where can I get my residency training done?
Yeah.
And because that now you're competing with everyone in medical school to get the best residency training slots.
Right.
So I lucked out. There's actually a little story behind this, where at the time I was still interested in otolaryngology, or ear, nose, and throat surgery. And so there's
Mhm.
something called a rank list. So before you graduate from medical school, um, you are trying to get into a residency program, and you rank which ones you want. And while the applicant can rank a program, the program that you interview at will rank you. And so that's why it's called a match. It's when the applicant and the residency program have decide on each other.
So you have to both swipe right, if you will,
Pretty much.
to hook up and get that residency. You
Yeah.
doctors figured that out way before the dating apps, right?
It would have been easier, I think, if we could have just done that.
And I
So
guess what you were alluding to earlier is, at this point, because you talked about earlier, you were an exceptional student in high school, so you got into some great schools. You went to several of them, and each time you go up this rung, from you, it's high school, bachelor's degree, master's degree, medical degree. It's the best of the best at each turn. I'll never forget, I just went to LSU law school. So, I think it's pretty well accepted that law school is easier to get into than medical school by a lot. And
oh,
LSU is a lot easier to get into than Washington, probably also by a lot. But I'll never forget
no,
sitting next to this guy who became a good friend and learning that he got a perfect score in his ACT and thinking, oh crap, this is different. I mean, I really appreciated Ponchatoula High School and my, foundation.
sure.
But as you go up into those higher rungs of education,
They're
The
pretty amazing
competition's
people out there.
intense. Yeah.
Absolutely.
So I might push back a little bit because it seemed like you were saying you lucked up into the next part of the story, which is residency and fellowship at Harvard Medical School. And it's my understanding you don't luck up into a place like that. I think maybe you're being unduly modest. But please finish your story. I don't mean to cut you off, but
No,
the
not at all.
argumentative lawyer in me wants to push back on that and give you your due because that's quite an accomplishment.
No, thank you very much. I appreciate you. One thing that you mentioned that I have a short little story about is the possible anxiety that one may get in realizing that, oh, you're not a big fish anymore. You're a
Right.
big fish in an area where there are plenty of big fish.
Yeah,
So,
you weren't in Poughkeepsie anymore.
no, not at all. So, quick story. I was as a student at WashU. It was weird how somehow our quote test scores from the MCAT might leak out, and so we can say, "Oh wow, that guy he had a perfect MCAT," like, and all of us were all like about 97, average 98th percentile and above on all our tests, right? But then if
Right.
there's somebody with like the 100th percentile, he still stands out. Well, so he might have been quote looked at in a positive light in the beginning, but this particular individual that I remember, he was a little younger than everyone else, and his level of maturity wasn't such that he made it through the clinical years of medical school intact.
Gotcha.
So you could be a fantastic test taker, but if you don't have other skills and you're not balanced, then you might not be able to make it through. So it is important to know your facts. It's also very important to learn how to take care of and communicate with your patients.
That's
So
that's a great point because I think according to my mom, I've not been your patient, but my mom has, and she shared that experience with me. And one of the things she loves about you is, obviously you have a Harvard level brain and a ton of academic accolades, but you also have that, EQ, if you will. You have that compassion and that bedside manner that helps her guide her through her journey, from intense pain to relief. And you make a great point. We want doctors that are well-rounded. Certainly there's a baseline of brilliance that we need in certain specialties, but that alone is not enough. And I'm so glad you point that out. So please continue with your story. I didn't mean to interrupt you, but I do want to say one thing, if you will. I'm going to share here a quote. If you can see the screen, Henry Go Tigers Who Dat Paz, aka Rico, who's a great guy. He says that both you and I are great guys, Dr. Lee. So I want to recognize him and say thank you for that comment. And anybody else who may be watching, feel free to comment. If you have a question for Dr. Lee or myself, we'll do our best to address that. We have the ability to pull them up on screen here if time allows. And Henry, Rico, so good to see you, man. I hope you're doing well. Thank you for sharing that. I agree with you. Dr. Lee is a great guy who's amazing at what he does. And with that, Doc, I'll get out the way and let you get back to your story because that's what people want to hear.
Okay, so but by this time I was contemplating, well, which residency and what should I do? Although I was floored by how amazing putting the needle into the skull was. In ear, nose, and throat surgery, they do something called skull-based surgery, and that also was very exciting to me at the time, and that's where I did some research. So
that sounds like the kind of thing that's exciting to the guy doing it, but not to the guy getting it, maybe.
Very true.
It's all about perspective.
It sure is. And so in ranking my specialties choices, I ranked Harvard anesthesia #1, and then I did Cleveland Clinic ENT #2. If I remember correctly, my third choice was Columbia anesthesia, and fourth was ear, nose, and throat. I believe it was at Ochsner. So
Okay.
I was going back and forth, and I was quote letting the match decide for me where I would go. and I'm very grateful in getting my first choice. And so I was able to go to Boston, learn pain medicine and how to take care of it through all these advanced different techniques, and learning how to manage complicated medications. through this process. So it was great. It is interesting though that in getting here, you have to go through. So my primary specialty, in essence, is actually there's some overlap, but there's also a lot of differences. So
Yeah, tell us
I was
about that.
trained in the operating room to perform anesthesia, where we quote knock people out, give them
Hmm.
general anesthesia, while and basically we typically intubate patients who are under general anesthesia, and we keep them comfortable so that
Okay.
when they have surgery where where pain is being inflicted upon them, we are managing their pain through the surgery so that when they can wake up and we extubate them, that they'll be doing great. So
Okay.
so the concepts are similar, but when you're taking care of someone in the operating room who is under general anesthesia is very different from someone walking in saying, hey, you know what,
Right.
doc, my neck hurts, my back hurts, what do I do?
Yeah. It's
And
quite different when you've got the foot long needle and the guy you want to stick it into and his face is is awake to see you.
yeah, that's for sure.
Now I know that you do some procedures under anesthesia when people are conked out, if you will, in the lay terms, and some when people are awake. Is that correct?
Absolutely. Yeah.
How do you decide when's appropriate? Is that something that the patient elects, or is that something that you decide, or is it a mix perhaps? How's that work?
It's both factors are important, but typically it's a balance of
Okay.
what the procedure requires as well as what the patient may require.
Gotcha.
So in anesthesia, you have different depths of sedation. So
Hmm.
you can have general anesthesia on one end of the spectrum and someone that's completely wide awake on the other end of the spectrum. And in between, you can go to from being wide awake to local anesthetic, where let's say you go to the dentist and the dentist numbs up your mouth. That's the local
Hmm.
anesthetic. Uh, to conscious sedation, where a healthcare provider may inject some medication through an IV to give you some anxiolysis or to help with making you feel as if you've had a margarita, so that
Right.
you can perhaps forget about the procedure or not care so much about it. And then the next level of sedation could be where you give more IV medications and one begins to fall asleep, but the anesthesiologist can then apply some advanced airway technique to make sure that when you fall asleep, that you can still breathe very safely. So then we have
Gotcha.
different things like LMAs, which is basically like this inflatable piece of plastic that you put into the mouth to keep the mouth open, and then
Hmm.
there's a tube at the end of it where you can help breathe for the patient. And then after that, then it's to knock the person completely out so that we can put a breathing tube um, into their trachea, um, and breathe for them with
Yeah.
our machines that we use with general anesthetics. And there's a whole range of them, and we learn all the pharmacodynamics and pharmacokinetics of
Hmm.
isoflurane, enflurane, sevoflurane, and all these different things that it's interesting that I don't even use anymore, because now I'm 100% focused on pain medicine and all the advanced techniques. So in a way, I'm kind of rusty in talking about general anesthesia
Right. Right.
because
Right.
I don't actually intubate patients as much anymore.
So
So
that general anesthesia pathway, it's a primary specialty, and you had to walk that journey and learn all that. But now you're in this very focused subspecialty of pain management and pain procedures.
absolutely,
Let's circle back to Harvard, because I have very limited experience at Harvard, so I spent a weekend there basically,
Harvard
and
is
got some
huge.
training. Yeah, it's I was blown away. There are tunnels everywhere, and of course the campus is older than the United States of America, technically, or at least pre-Independence Day. It's the oldest and probably most prestigious school in the country. So, what was that experience like? Because you're from New York, and you did Columbia, but you didn't grow up in the hallowed halls of a place like Harvard, or even in the city of New York. You're from Poughkeepsie, smaller, community. What was that like? Once you realize you're there, and of course you were there a while, residency,
I
fellowship.
was, I was.
It
So
wasn't a fun weekend like me. It was a lot of blood, sweat, and tears.
I gotta
Tell us
say,
about that experience.
during residency, you work 80, 90, 100, 120 hours
Wow,
a week.
it's
So
amazing.
I didn't, even though I tried to keep things as balanced as possible, I still didn't really get to quote enjoy. Um, it wasn't like vacation, but
Right. After orientation, all the pretty buildings were an afterthought, I guess,
so,
right?
so I
You're
did
in the
my
weeds.
internship year in right outside of Boston in a small
Mhm.
community called Brockton. It was
Okay.
associated with Tufts Medical Center, and the reason why I chose that is because it was a transitional year, which allows you balance, where you can do
Right.
surgery, where you can do general medicine, ICU, radiology, just so you can get a broad experience. And after that year, then I moved to downtown Boston.
Mhm.
So that would be obviously I have to wake up really early. Most of the time, uh, surgeries start at 7 a.m. And so the anesthesia resident would go into the hospital usually around 6:15 or earlier to get the anesthesia uh, all the apparatus to make sure it's all ready, to get the
Mhm.
medications ready. So we do a lot of pre-op planning to make sure that we can utilize the best techniques to help our patients in the operating room go through surgery. So that took up quite a long time.
I
So
bet.
we have clinical anesthesia year one, which is basically PGY2. We have all these acronyms for all these different
Mhm.
years. PGY stands for program year, and so intern year is your PGY1 usually. Program
Okay.
year two is CA1, CA2, CA3, and CA3 is the third clinical anesthesia year. So that's usually when you decide what if you want to continue doing general stuff for anesthesia, or if you want to specialize in and get a fellowship. So that's
Okay.
another um, opportunity to interview and try to get into the program. And so I wanted to become a pain management fellow. So I interviewed to get a spot so that I could get my certification and in pain medicine.
So I'm
The other
sensing quite the overachiever here. Graduate from high school early, add a master's degree to your medical degree while you're at it, and now fellowship on top of the internship and residency everybody else is doing.
Yeah,
What,
for quite a while,
where do you
my
think that
whole
comes from? Switching gears a little bit, where does that kind of drive come from? Because I cannot imagine how worn out and tired you must have been at this stage of your career, but you're choosing to do
no,
more.
I
Is it
think
an
when you're in
ambition
the
thing
middle of
or
it
what?
and you're surrounded by all your peers who are all
Hmm.
getting trained, trying to gather as much knowledge as possible, it just becomes um, a daily thing. It doesn't seem so different. My
Right.
sister actually is also Harvard trained. She's an orthopedic surgeon downtown, and
Okay.
so um, I think that we grew up wanting to learn and become the quote master of a particular field, so that you
Sure.
could help others. And she was drawn to orthopedic surgery, and I was drawn to pain medicine.
Are
And
you who's older, your sister or you?
I'm a year older.
Okay. So did you? I assume then you got to Harvard before she did. Do you think that influenced her decision, or was it just that that orthopedic program there was so great?
So orthopedic surgery is an even more intense residency than
Well,
anesthesiology. So they have to spend, I think, an additional 1 or 2 years more than an anesthesiologist does in their training.
mhm,
And then she decided to do a fellowship in ortho trauma, specifically
okay,
to help those that are hurt in car wrecks, so that she can piece together broken pelvises and things.
sure,
But I think our parents
gotcha.
really helped us. We've always been very 100% support. They always encouraged us to do our best, and they kept the ground very fertile for us. They helped us, nurtured us, so that we could learn.
Right.
And without that support, there would have been no way for us to do all this. So.
I appreciate you sharing that. That's so true. It takes that strong foundation at home to give kids every opportunity. And, you got to go out there and earn it yourself. You had to get up early every morning to make it in there before those 7 a.m. surgeries to work 90 plus hours a week. but sure is a heck of a lot easier when you know mom and dad have your back, and you've
Sure.
got siblings that are there to help you too. Well, tell me this, because we're almost a half hour into our talk here,
Time has really
and
flown.
I'm kind of, I mean, it seems like that. How'd you end up here? Because we're talking about a fellow here a literal fellow who could do anything in the world with an education and training like that. You were in demand from the best hospitals in the world. You could do
So
anything.
we're
What
very
brought you to
lucky
this area, Louisiana?
because this field is actually really in high demand.
Hmm.
And we are blessed in having the choice of typically where we want to go. So at the time, my sister had actually moved down to New Orleans,
Okay.
um, and I at the time, this is about 7, 8 years ago. I spent my first year out of fellowship in New York, and I was in an area that this was upstate New York, like basically Canada, New York, and
Okay. I
they
hear they're
sent
getting
me.
some really rough weather up there right now. I was on the phone on Zoom with a buddy from Kingston today, and he was telling me you don't want to be there right now.
Like the Arctic.
Right, right.
um, so I was actually trying to find a private practice where I could be working with other pain physicians that were trained similarly. And that way we could bounce our ideas off of each other, and that we would have similar styles
Right.
of practice. And so I attended a pain medicine meeting. Uh, there we have several every year where our pain management specialists get together and keep up to date with all the techniques and um, medications that might be new on the market. So that's where I met Dr. Mohammed Elkirsch
Great doctor.
at a Fort Lauderdale meeting. And
Hmm.
we began talking, and I had remembered that we shared a common mentor. And he was our program director, Dr. Thomas Samopoulos, over at Beth Israel Deaconess Medical Center, which is part of Harvard Medical School.
Okay.
And I remember that he had talked about Dr. Elkirsch very fondly, saying, and almost um, he said it in a very positive light, where despite having to go through the field of anesthesia and learning that, he knew Dr. Elkirsch hated anesthesia and just loved pain medicine and never
Right.
even looked back from moving from the operating room to treating people with pain. And so when I brought that up with Dr. Elkirsch in Florida, we were able to really get along. He mentioned that his practice really needed help because he had so many patients and he couldn't see them,
Right.
and he wanted to see if I'd be interested in working here. And so, since my sister had already uh, moved to New Orleans um, by
She
this
could give you
time,
a glimpse of that po' boy lifestyle down here.
right? Yeah, and it
Right.
was
You knew a
it was
little
the
bit
whole
about a
idea.
gumbo thanks to your sister. That was helpful.
It was because she knew all about that before me, and so
Yeah.
she
So
was
you
the
were the
actual
trailblazer in Boston that introduced her to Harvard, and then she returned the favor down here in Louisiana. That's neat. Well,
Well,
speaking of Dr. Elkirsch, you guys, have Advanced Pain Institute in Hammond, and y'all do great things. I'm going to refer again to another comment here. Brandon Ricotta talks about minimally invasive, um, terminology and the type of procedures you do at API, the Advanced Pain Institute. Can you tell us a little bit about the services that you and Dr. Elkirsch and your other partners provide there?
sure. So most of our procedures um, are typical injections because we try to help patients avoid any unnecessary surgery.
Right.
Now, there are some instances where a small injection may not be sufficient. And so, under those circumstances, there are some minimally invasive quote procedures. So that is more of a layman's term, minimally invasive. It evokes not making a big incision in someone in order to get something done.
Yeah.
So
Think Band-Aid, not ace bandage wrapped around you, huh?
yeah, that's a good way of thinking of it.
Right.
And so if a small needle can't do it, then a minimally invasive procedure might be something like a larger gauge needle where you can pass an instrument through it. And
Okay.
so there's an example of that where, let's say, someone who is a typical person older than 65, starting to get bad arthritis in the lower back and get something called spinal stenosis. If they have
Hmm.
spinal stenosis, it means that the bone spurs are squeezing the spinal cord area shut so that the person may not be able to stand up straight or walk very far. And so a lot of times you see these individuals having to lean forward in order to try to
Right.
open up
Hunched
their back.
over.
A
Hmm.
minimally invasive procedure that I perform is I can inject a titanium spacer into um, the between the spinous processes of the spine to open up the collapse to fix that problem. So if the problem isn't too far gone, then this is a fantastic procedure, outpatient procedure. Someone can come in to our ambulatory center and leave in 30 45 minutes with their back fixed.
Yeah, that's amazing. Wow.
Yeah.
So it's like that. It's like that light bulb moment you had earlier in your career where you saw that foot long needle go into a face and change somebody's life by removing the pain and bringing relief. And now
One of
you
the
can do
reasons
that.
why I love that is
Uh-huh.
so in surgery and in pain medicine, there are times where if you do something correctly, patients just feel better immediately, and the difference
Right.
is night and day, and I love that. And
Hmm.
another example is, let's say an older person fractures their back and their vertebrae gets crushed. So we fix that by injecting cement and lifting up that collapse. So that's another instance where someone who comes in hurting can leave the operating room or procedure room in literally 20 or 30 minutes, and their pain's completely fixed.
Right. And I noticed that you're using examples in the spine. And, I've had about 1,000 cases in my career as an injury attorney. And it seems like overwhelmingly the spine, the neck and the back in particular, are the places that get injured the most. Has that been your experience? Are you seeing a ton of spinal injuries and back
I would
pain, neck
say
pain?
there are a lot of injuries to the spine,
Mhm.
absolutely, and especially since we drive all these heavy, big trucks and SUVs on
Yeah.
the road.
Yeah.
It's very natural. Um, our bodies are not designed or evolved, whichever way you'd like to think of it, as um, to be able to absorb injury that
Sure.
occurs from a quick impact or whiplash.
Mhm.
Um, and our spines are frail in that sense. And so
Yeah.
our necks are small. If our necks were as big as Mike Tyson, then we might be able to take a couple of good
Right.
punches and not hurt our necks. But most
Yeah.
of us don't have that strength in
Yeah.
our
Few
necks.
people on the planet are built to take that kind of wallop.
Absolutely.
One of the things I wanted to ask you about is the opioid epidemic. And, I think this is one of the things I've always liked and appreciated about your style of practice is that you're trying to get people relief with that, without having to resort to narcotic pain medicine whenever possible, whether it's the type of injections and minimally invasive, treatments that you've talked about. I know you often will refer folks for things like physical therapy, but tell us about what you and your clinic and your colleagues are doing to, really try to get people well and relieve pain while avoiding the tragedies and just the problems that come with narcotic pain medicines.
So I think it's really important to determine and diagnose what the problem is coming from.
Hmm.
And if sometimes the delay in diagnosis could mean a patient really asking for, oh, can I have any type of relief? And if that happens and they end up, uh, a physician might be trying to help to alleviate someone's pain by giving someone a pain medication or a narcotic. But we've learned over the years that that does more harm than good many times.
Right.
And
Yeah.
so it's very hard to say no sometimes to someone that's hurting and says, "Hey, doc, can you just help me? I feel terrible. I want this pain
Yeah.
fixed." And then to say, I'm sorry, I really believe that if we go to the source of the problem and fix your pain, then that would be better than giving you this pain pill. And I got to tell you that that's a struggle sometimes.
I
But
bet it sounds like something much easier said than done. Right now it's just an academic concept with two guys talking about it. But when you're in the room with a patient in distress that you can see is in incredible pain, that's got to be hard to stick to your guns on that and stick to the path that you prescribe.
It can be, and it's interesting because when you talk to other pain doctors, and you sometimes we check out some of us occasionally check out our health grades, our online evaluations of us,
Right.
Coming from the patient's perspective. And the pain doctors, we kind of say, look, we don't want to be at 100% patient satisfaction, because usually that may mean that these may be doctors that are giving out a little bit way too much on the narcotic side of things.
You've got to tell people no in their own self-interest.
That's very hard for someone to swallow sometimes. If someone says no to you, no one likes to be told no about what they want.
Sure.
So it's hard. So it's a tricky balance. But I think that if you could treat your patients like they're your family and always try to do what's best for them, sometimes you have to tell your family members no. Like, I have a little daughter. Hey, no, you can't watch TV all night. No.
Hey, I've got
can't have all that
2-year-old and a 4-year-old. I hear you.
Right. So
they don't want to hear it, but you're right. It's in their best interest, just like it is for your daughter. Well, what else would you like to share with us about what you do, about your journey? I've kept you longer than I promised, so I know I'll need to let you go here soon so you can get back to that daughter. But what else is on your mind, doctor, that you'd like to share with our community?
We are in Hammond. We're also in Covington and Slidell. We try to make ourselves available. And I would love to, if someone or if it's your family member that has been struggling for a long time with a pain issue, I would love to be able to meet them and do my best in trying to figure out how to help. And I am very straightforward. From New York, I value everyone's time, and on our first visits, I really just try to lay it out very straight so that my patients can decide, okay, this is a method of therapy that I think I could undergo, or they can say, you know what, I don't think that's for me. And if I can share with them what we can do, then a lot of times there's a possibility for miracles to happen.
Yeah. Well, thank you for sharing that. And I would love to endorse your practice here because, again, I've seen it work for my mom. I've seen it work for clients. And I know that not only are they getting pain relief in some really tough circumstances, post car accident injury, but I know that they just genuinely like you. Mom tells me you're approachable. You're an uplifting guy. Anybody who's watched this can see that you have a great bedside manner. And so I believe your website is painexperts.com. Did I get that right?
Yep.
So I would recommend anybody watching, check out Advanced Pain Institute at painexperts.com. Their clinic in Hammond is literally just a few hundred yards away from the Ponchatoula Hammond city line. It's right north of North Oaks. If you know this area, North Oaks is in Hammond, Belle Maison next door is in Ponchatoula, and API, Advanced Pain Institute, is just a few doors down. So
I would Google Advanced Pain Institute just in case that I didn't get that web address correct.
Well, I'm looking at it right now because I pulled it up for your bio before we went on. So I'm painexperts.com. If that's wrong, that's on me, not Dr. Lee. But Google Advanced Pain Institute, Dr. Steve Lee. He's not only a great physician, he's a great guy. And doctor, I know your time is extremely valuable. I know you're busy in your profession and you're a family man. And I just want to thank you on behalf of all of our viewers for sharing your time with us today. And to our viewers, thank you for tuning in. We will be back next Thursday at 5 p.m. And we look forward to seeing you then. So take care. And Dr. Lee, once again, thank you, sir.
Thank you for having me. Take care. Bye.